So there's two different types of medications for peripheral arterial disease. There's medications that help reduce the risk of progression of the disease process, such as cholesterol medications and blood pressure medications. And then there's medications that help reduce the pain and discomfort from peripheral arterial disease, but not necessarily reduce the progression of the disease itself. So all patients with peripheral arterial disease are at risk for cardiovascular disease or an increased risk for heart attack and stroke. And so it's really important to control cholesterol, which affects both peripheral arterial disease and those cardiovascular diseases as well. So there's multiple medications which reduce cholesterol, the most common of which is often a statin. But statins need to be managed by a primary care physician because they can affect the liver, and often liver function has to be followed by primary care doctor. It's also important to control blood pressure and diabetes. Often our patients have high blood pressure and diabetes in conjunction with their peripheral arterial disease, and these all affect the disease progression as well. So it's really important to control diabetes and hypertension. All of our patients who have peripheral arterial disease are also at risk for heart attack and stroke. The same disease process that narrows the arteries in the legs can narrow the arteries in the heart, and when those heart arteries get narrowed, that can cause a heart attack. They can also narrow the arteries in the neck, and when those arteries are narrowed, that can cause a stroke. So it's really important that we not just focus on the symptomatic disease in the legs, but that we're also controlling the risk factors for the disease progression and that can cause heart attacks and strokes. So there are several medications that can help with the cramping that you're experiencing in your legs. One's called Pleatol, another one's called Trintol. Both these medications are effective. They have been shown to improve how far a patient can walk before they get cramping in their legs. If, for example, you're having cramping when you're walking in the grocery store and you can't make it all the way through to the cash register, often these medications, in conjunction with quitting smoking, can get you all the way through the store and get done what you need to do during your day without having that discomfort.
Many times, if I diagnose a patient with peripheral artery disease, they've been exposed to one or more of these medications already. But I also have to say that a number of patients aren't on appropriate guideline-directed medical therapy. These are very basic, generic, easy to start medications that do carry some risk, but the benefits far outweigh any of those risks. And because they are widely available and underutilized, a lot more patients probably have heart attacks and strokes than otherwise would if we were more adept at starting patients with PAD on these drugs. Cilostazol deserves special mention because it has some unique side effects, and I usually explain to patients in some detail what those side effects are. We usually start cilostazol at 50 milligrams twice daily, which is really a half dose, because patients started on a full dose have about a third of patients have side effects of palpitations, headache, and GI upset, including diarrhea. And if a patient were to start on a full-strength dose of that medication, some of those can be quite surprising and certainly lead to stopping the medication altogether. I find in my practice that if I start cilostazol at a half dose for 2 weeks and then escalate the dose to a full dose thereafter, patients then tend to tolerate it a lot better.
So both Pleatol and Trintol, which are used to help diminish the discomfort from peripheral arterial disease, cannot be used in patients with congestive heart failure. And so we really need to make sure that the heart is healthy enough before starting those medications. So it can take Trintol and Pleatol many weeks, often 4 to 6 weeks, I tell patients, before they can see a result. So don't give up on the medications before you've given them a shot.